Good evening, family and friends of Whitney Oaks Care Center. This is Kyle Dahl, the administrator of Whitney Oaks, coming to give you a update on the happenings here at Whitney Oaks. I want to first thank all of our essential staff who have been doing an amazing job under very difficult and challenging circumstances. Our doctors, our nurses, our CNAs, our environmental service team, from laundry to housekeeping to janitorial, for their extra work, for our dietary department, and our activities team and social services, and the list can go on. We have 230 employees who are working busily under stressful circumstances every single day to ensure the well-being of all those who are under the care and our watch. There's a few, I'll refer to some of my notes as we go on, but I do want to thank you as our family and friends of Whitney Oaks. There's been a lot of differences and changes that have occurred that have made things challenging for all of you. Not being able to come to the facility, not being able to as easily get your family member on the phone, or maybe not as easy to set up and talk with video conferencing as some of we're waiting our turn, so to speak. But we want to thank you for all of your patience. We want to thank our county and state and federal partners who we have been working closely with. We talk with the California Department of Public Health every single day. We have routine weekly calls with the larger group of the California Department of Public Health on advisories. We have calls with our local public health, with the CDC, and our policies and the ways we've gone about doing things honestly are changing and fluid, and as we gain new information and knowledge, we continue to modify and put plans in place kind of for worst case scenarios, and we continue to pray for the best and plan for the worst. And so we do want to thank each and every one of you as we move through this process. Just as a general overview, in the throughout the world, there's 526,000. I'm sorry, in here in the United States, there's 526,000 cases. In California, there's 19,472 positive COVID tests. That absolutely is a big number, but also doesn't reflect all those that haven't been tested due to not being in the age group or having certain pre-existing conditions, and they've been asked to go home and shelter in place and those type of things. Here at Whitney Oaks, we're pleased to let you know that we have not had a resident in the facility or a patient in the facility who have tested positive. Currently, we do not have anybody on isolation for any reason, droplet isolation or contact isolation, and that's amazing. None of our staff have been tested positive for COVID. In this case, we do have people who occasionally get a fever or occasionally have some shortness of breath, or what we would usually refer as flu-like symptoms. And so for those folks, we've taken the necessary measures of isolating them until their testing is done and the testing comes back. And fortunately, at this point, all of the tests have come back negative, and they are isolated away from the facility until they're symptom-free, no fever or anything like that for at least 48 hours. Having said that, we have heard many news briefings that some people don't present with this novel coronavirus or COVID-19 in the same way. And so not everybody gets a fever or not everybody gets a cough. And sometimes they don't even have the shortness of breath. We've heard of cases where they may just have a migraine type headache feeling that isn't relieved through normal medications. And so in the end, we all have to get groceries. We all have to get gas. We are out in the community as a entire community in our county and in our state. And so we're still, even with social distancing, interacting with people that very well likely might have the virus. And so some have asked us here at work, well, how can we 100% make sure that nobody gets it? And the reality is that we can't. There is no guarantee as it relates to who may or may not get this coronavirus that's out there. And so most importantly, what we can do is continue to monitor, which we do every single day. Every patient still gets a temperature check every day and a complete set of vitals. And we're monitoring anything that might be different from them from before. In addition, each staff does get screened daily for a temperature as well. We ask them to answer a handful of questions that keep evolving with the work with the CDC and with Health and Human Services to make sure it's not, before we used to ask them about travel plans and things, and at this point, traveling and whatnot isn't where people are getting it. But we do ask them kind of risk factors. Have they come in contact with anybody that they know to have had COVID-19 and things like that? And so we can kind of screen out people that may be symptomatic or may have come in contact with somebody who's symptomatic. So we take each of those on a case-by-case basis and work with our medical director and Sacramento County Public Health. But again, fortunately, at this point, we have not had any of those cases here. It's in our hospitals. Our local acute care hospitals have multiple patients who are in the ICU or who have been in the hospital with COVID. We know in Northern California, multiple different senior care facilities, even here in Sacramento, have had COVID cases or employees who have had COVID. And generally speaking, what we have found is that it has not spread widely. As I know in the news this last week, a facility in Riverside had a number of cases and had some challenges with that, and some of the patients had to be evacuated into other facilities. One of the big keys that we try to instill into our staff is that the goal of planning and being prepared. Just this week, the CDC made a recommendation that when staff are inside the facility, that they wear a face covering. So this isn't a fancy neckerchief. This is actually one of the face coverings that has been made. They're made out of quilting fabric, and we've been fortunate enough to have some of them donated. I want to look to my notes here. I want to thank Sacramento Blankets for Sacramento Kids, the Church of Jesus Christ of Latter-day Saints, and Bayside Church for their donation of 200 face cloth coverings. These in and of themselves do not restrict COVID. They're not intended for that. But what they do allow is the staff member to be able to have something where if they sneeze or cough, that they're not spreading the germ farther out into the facility, and then they can take them home and wash them each day. We have a different color on the side so they know which side they're supposed to put where. And so we've been distributing those out to the staff members. I was able to give multiples of those out today. And so we are following the CDC recommendation. That's something new that we've implemented. Since we last spoke on video, we have put in 3 healthcare HEPA filtration systems, one at each nurse's station, one in the front lobby where we have the most foot traffic, and it picks up 99.5% of all viruses and bacteria that is in the air to just try to thin out any potential. We did form that partnership I talked about a couple of weeks ago with Clorox, and we have received one of their Clorox 360 machines. And with that machine, it allows us to spray a positively charged mist onto a surface, and it connects to that surface, adheres to that, and within 2 minutes, all the viruses that we've been worried about in this season, including the COVID-19 and the influenza, are killed within that 2 minutes. In addition to that, we do have our environmental service team that goes in and cleans all of our high touch areas, and every patient room gets disinfected every day. In normal circumstances, you would use a window cleaner. We actually are using disinfectant for all of those different kinds of services to just make sure that people are staying as healthy as we can through the process. We've had a couple of things come up since we last spoke through this medium where there's been some suggestion that visiting family members at the window of their room might be a good idea. And we have talked with our county public health officers as well as our local infection control team here, and we have determined that to be an unsafe practice in that we have multiple beds, there's no private rooms, and so people would have to be going into the isolation space or that 6-foot separation space to be able to get to a window to talk to somebody. And in addition to that, we have about half of our facility, their window faces the interior courtyard, and they would not be able to have somebody go through the facility to go to a window to talk to their family member. And so in conjunction with talking with our agencies outside, have determined that is not a safe practice. So we're not allowing people to do window visits. We are recommending that you call. We have our portable phones. We are recommending that you talk with our activities department, and we will connect with you to be able to take an iPad in so you can see your loved one face to face. We do have a couple of different applications downloaded on that, including Zoom as one of the more popular ones that are out there. Some have asked us for a couple of different things, including FaceTime. And as an Apple product, we can provide that for you if you would like to see your family member face to face, or you can call them directly if they have a phone. We do have a messaging service, if you will, on our website, www.whitneyoakscarecenter.com, and you can hit contact or leave a message, and we print that, and we can actually take that and read that to your family member if that's a medium that you would like to do. And we have a Facebook page where we try to put updates on that as well of things that are going on. And we also have on our website at the very top, there's links to frequently asked questions, and you can click on that and look at some of the things as things continue to evolve. We can have you go to that, and we, as far as like visitation and things like that, which still has not changed, we do post those updates there, or if there's any new recommendations. We have appreciated many of you who have brought commercially produced items or food for your loved one or family or friend, and we appreciate that you're putting your name on them, and our staff have been able to get those out to your loved ones very quickly. We've had several people have items shipped to the facility through Amazon or other services like that, and we also have been able to get those packages onto your loved one as well. So if you run into any problems with that, feel free to reach out to us, but that part has been going smooth. And since we did do, we will continue to do the phone bites, which are just a quick 2-minute update on a weekly basis of things that are going on. It allows you to opt out of that by just hitting the number 5, and then it will let you opt out so you don't get those calls. But we are trying to give you some communication outside of this video format, which is a little bit the longer version of things that we're doing, where we have a small finite amount of time that we can actually give you information through our phone bite automated robo, if you will, calling that just gives you a snapshot of what the week has looked like. We still are not having communal dining. We're not having communal activities, although our activities department is continuing to do things where they have hall bingo, where there's social separation. In the last couple of weeks, we've had our social service team, along with our activities department, have brought in their guitars and are singing hymns. Some have requested different kinds of music or inspirational music. And so they have done that. We have them do one hall at a time. We've closed the fire doors just to keep each area kind of separated. And so they'll go to each hall and they all get their own special event or show. We have one of our employees who's a minister in one of the churches here locally, and she does Bible reading out on the floor, and people are able to listen to that as well. We have other music that we're playing periodically throughout the day for people to listen to kind of break up the day. If you have any other ideas, feel free to reach out to us. And we've opened that up to our team to participate as they are essential personnel. They can be here, and we're utilizing some of their talents to lift the spirits of some of our folks. I had an interesting conversation with one of our residents who is 80 years old, and she says, I was there when they had polio and all these other things, and I don't like being cooped up. And but at the same time, she'd mentioned that she'd had some previous health conditions that necessitated her being here, and that would put her at a high-risk category, being more exposed. And so a lot of people aren't really thrilled that they're kind of cooped up, and there is a little bit of cabin fever, even for our folks and kids trying to get school and their spring breaks. And some of we acknowledge some of the disappointments of some of your family members that might have kids or grandkids that would be graduating or participating in athletics or doing things that they're not able to participate in, and we do feel bad that that's happening to so many people, but we still feel strongly and support our state, our governor and other state officials and our federal officials who are a lot smarter than we are in this regard in terms of the social distancing. We're hearing that that has made an impact, and certainly when we look at the numbers in California in comparison of those in New York, our numbers are substantially less. But we also are hearing that our peak time will be probably over the next week or two, where the feeling was that, at least at the time, that New York's peak was more ending here as we're going into this weekend. And so we'll see where the numbers trend. We're hearing some of the modeling that some of the mortality rates that were initially projected by some of the models were overstated. And so that's actually a good thing, and we'll hope that that will continue to be the case. We still are not having leave of absences, so we're not having people go out of the facility for activities to then potentially be exposed and bring that back into the facility. We are only sending patients out for mandatory doctor appointments. If not, the patients are being seen by the doctors here. And we also are providing telehealth, where the doctor is able to get all the vital signs and things like that from the nurses, and then in turn is able to see the patient through the video application and then make any recommendations and kind of walk through with the patient what might be going on, especially if there's some type of change of condition. So that is been going well, and we've implemented that in many cases, especially after hours, instead of sending a patient to the ER where they might have more exposure. If the doctor is able to see the patient and make some additional orders, then we can take care of that. One thing I do want to mention, and I've talked about this a little bit with both the staff as well as in some of our previous phone bites, although there is limited PPE or personal protective equipment, our facility does have PPE here. And if there were a case that presented itself, or if the hospital surged and there was a need for patients to come to our facility, we do have N95 masks, we have procedure masks, we have isolation gowns, we have booties, we have face shields, we have items for cleaning, and we handle a lot of different pretty serious superbugs, things like MRSA, VRE, CRE, even just the regular flu. and other bugs that are out there. And so with that, we do have those supplies. We have them here at the facility, and we could act upon those things very quickly. We are not putting those out routinely because we want to make sure that with the limited supply that is out there, that if there was an outbreak here, that we could have those necessary items available and quickly. And as we are affiliated with Plum Healthcare and we have 50 other facilities, we've been able to move around some of those PPE in certain circumstances where they may be needed for certain situations. And so know that although we continue to ask for donations if we have them, and we continue to ask for additional cloth masks because some will wear out as we are washing them daily, it doesn't mean that we don't have the supplies that are necessary if an emergency were to occur. We also are acutely aware that a cloth mask is not going to stop a coronavirus or even the flu. But again, if the person were to cough or sneeze, they're coughing into the mask versus coughing into the space in the facility and putting droplets where other people may touch them or come into the area and breathe. And so we're working on all those different avenues to make sure we're being as safe as possible. With a few other just small items, actually, I think I've gone through most of the key things I wanted to talk about. I know this is a little bit longer, but I haven't done a video in a couple of weeks. If you do have questions, you can feel free to reach out to the nurse supervisor who oversees your family member. You can reach out to Ruth in social services or Zeb, her assistant, to ask any questions. If you have operational questions or things that you're worried about or concerned about, feel free to send me an email. My email address is K as in Kyle, Dahl, D as in David, AHL @plum.com. And as we get those, we'll do our best to respond as quickly as we can. We literally have 2 video conferences almost daily. In addition to additional information that's being sent to us with updated questions, updated preparation plans, and updated staffing requests and personal protective equipment. We do have the ability to section off one of the hallways where we could put plastic up that would have the zipper and would have the stakes that would allow that entire area to be cornered off. We're fortunate in this facility in that we have a radiator heating and cooling system, so there is no shared vents that go from room to room at Whitney Oaks, and so anything that gets filtered in the same room. And so if we needed to put the air filtration system in that room, or if we needed to crack a window to add for that, we have that ability to do that as well. And so I want you to know I've challenged our staff to continue to make sure that our patients are being well cared for, so that upon your return, that when you see them, you can see that they have been well cared for in your absence. And so we continue to do that. As you can imagine, there are times when staff have other obligations, such as their own kids in school or things that they have to take care of. And so some of our non-essential staff in terms of our business office or our payroll department and things that don't have to be here, we're having them work out of home and conferencing in and taking information that way. And so sometimes there's a little bit of delay in getting some of that information back to you as quickly as we would like to. And also in some cases, staff have to be home for one reason or another. And so we don't always have the complete full staff to do everything that we normally would do on a regular day, but all of the essential things are being done every day. And we want you to ensure you that the doctors are still continuing to come and visit. Their nurse practitioners are here. They're practicing safe infection control techniques as well. We have plenty of soap and water, and we encourage our staff to use that many times throughout the day. And we still have all of our hand sanitizer machines are full, and the staff are able to use that as they come in and out of patient rooms. And we have plenty of disinfectant that we're using very liberally on a regular basis throughout the facility. So I've talked a lot. Hopefully some of that information is helpful to you. If you find that beneficial, we'll continue to do these periodically. As of right now, the stay-at-home order in California is through May the 1st, is the dates we have. That may change based on the fluidness of the situation. I would imagine that when the stay-at-home order is opened up, that there may be some situations where they still have us screening people as they come and asking questions and having the temperatures checked and wearing your visitor tag that shows that your health has been checked and things of that nature, or that you've been screened. We have not had any word on that, and we're not anticipating that anytime over the next several weeks, and then we'll see early into May as things would open up. So we want to wish you all well, let you know that we are doing everything in our power to ensure the well-being for your family member, as well as our own staff. We want everybody to be well, and we hope that you're doing well at home under very unusual, exceptional. I've been in healthcare for over 2 decades and was in the EMS system, working in ambulance prior to that. And I've never seen anything like we're experiencing now, and I'm sure for many of you that's been the case as well. So we want to wish you a good night, wish you good health, and for those that are struggling in their financial situations, we hope that you're able to recover from that quickly. And the work that we're doing here, we're hoping that gives you a peace of mind that you can go about the things that you need to do to take care of yourself and those that are around you. So with that, I will say goodnight and Godspeed.